Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today in the show, we welcome back Wayne Jonas. He's a family physician. His Kevin MD article is titled How Whole Person Care Can Make Us Better Healers. Wayne, welcome back to the show.
Thank you. Great to be back, Kevin.
We'll get into the article in a little bit. But for those who didn't get a chance to listen to our first episode together, just briefly share your story and journey to where you are today.
Sure, happy to. So I'm a family physician have been for the past 35 years, perhaps, or a little more, I'm not counting. Most of that time was spent in the military, where I took care of soldiers and their families, and retirees, veterans, et cetera. And actually, I still do that. I still see in a military clinic, and I still teach residents and students in the military, learning in the military. As part of my journey, I had the great opportunity to run the Office of Alternative Medicine, help turn it into the Center for Integrative Health that it is today, run a World Health Organization traditional medicine center, and then was supported by the Samueli Foundation for 20 years to do research in the area of healing traditions in those areas. And in that process, I got exposed to something that I really originally went into family medicine for, which is to take care of the whole person. But I realized there were many healing traditions that were doing it much better than we were, because we've lost this idea of being a healer in the hustle and bustle of all the technology and the time constraints of trying to cure. Now, cure is important, we want to do that, but we need to regain why many of us went into becoming physicians in the first place, and that's to be healers along with the treatment component. And so that's my background, that's what I try to do.
So give us an example of how other cultures have taken that healing role better than we have, because what you're saying is completely right. There's just so many obstacles, right, that interfere with our healing of the patient. There's so many time constraints. What are some other cultures that do it better than us in your view?
I think many cultures and many traditional healing systems actually get to know the person outside of what we normally count as medical areas. So the social and emotional life, the mental and the spiritual components of the person, what matters to the individual, is part and parcel of what they do in talking to the patient. That doesn't mean they don't go about diagnosing and trying to do things in their own way in those areas, but they don't do that only. It's not just about what's the matter with you, it's getting to know who you are as a person. And so the bottom line that I learned from these approaches, and actually our system has done this too and embeds it in certain types of disciplines. And I think in the past, before we got so embedded in the economic drivers around treatment, we were doing this too. Originally in medicine, if you go back to Hippocrates, this is a key tenet of attending to the social, emotional, spiritual, lifestyle, and behavioral aspect of a person, not just give them the treatment or the herb in those areas. And so I learned a lot of that from multiple other cultures, and we can bring that back into our system too.
And you talk more about that in your Kevin MD article. It's titled How Whole Person Care Can Make Us Better Healers. Now, for those that didn't get a chance to read your article, just walk my audience through it and share the story why you decided to write it.
Yeah, I wanted to illustrate how this process can be done right now, right in a normal sort of overall practice. And the story is about actually someone's fairly typical, is what I see in my practice. This is a service member that had chronic pain. He came into the residency program into our pain clinic with chronic back pain, but he had multiple other problems too, mainly psychological problems. He had PTSD from his deployments in the war. He had depression, he had anxiety, and he came in actually asking whether we could give him CBD. He wanted some kind of cannabinoid. After the resident saw him, the resident suggested we change his psychotropic. And then I used a set of tools to ask him what was the most important thing in his life, get him outside of the medical framing and say, what's important to you? And what emerged from that discussion was that he was extremely isolated and he was embedded at home by himself and his cat. And his wife would come home, support him in the evening, but he didn't get out. He didn't go to therapy. He didn't go to groups, etc. Didn't have very many friends. And that led to an honest conversation with him about his history of adverse childhood experiences, how the exposures in the war exacerbated that, and that made him essentially a social isolate. And what he needed is a way to become aware of how to actually break that component. He was willing to start a series of journaling components, that he started journaling about his traumas, about his childhood experiences, about his experiences in the war. Eventually, that began to give him the courage. He didn't share them with anybody. He just wrote it for himself. But that gave him the courage to begin to see a counselor. That then got him into group therapy. And he really started his healing journey at a much deeper and more fundamental level than simply taking CBD oil or changing his mental medication.
Now, how difficult was it for you to get this patient to open up?
Yeah, there's a process for doing that. In fact, there's even a science for doing that. It's often called health coaching or behavioral change science. We know a lot about it, but we don't use it very much. It involves motivational interviewing. It involves asking and listening to the patient to identify what drives them, what motivates them in those areas. It's shifting from patient-centered, where they're automatically in the healthcare system, to person-centered care, finding out what's important to them. And if you listen to that, they will tell you, actually, that you've got to structure the dialogue and the visit that way, and you have to give them the time and the support to do it, okay? It can't just be about what's the diagnosis, what am I going to hand you over? It's actually remarkably rapid if you use the right tools. And the tools I used were originally developed within the VA, the Veterans Administration, and we've cultivated and created those tools to make them easier to use outside of that system. I use a questionnaire called the Personal Health Inventory, which is how I learned about his isolation and the areas that he was willing to go into. And then I had what I call an integrative health visit using a set of tools called the Hope Note and a set of resources that could be brought to him in those areas. So I can do this if I don't know the patient. It takes me a little longer than 20 minutes, but if I do know them and they're coming in with a chronic illness and I'm not worried about their diagnosis, you know what I've already done the SOAP note, right? I already know the medical treatment on that. And now I want to bring the healing components and empower them in that process. These are the tools and the mindset that can make that happen within routine practice. And so we did all of this within about 30 minutes. Now, he had to come back, right? It wasn't a magical cure, but that's all right. He'd been coming back for a long time to get his medications and to get treatments and all that kind of stuff. But now he was coming back really to address something that was core to him, okay? He was in the driver's seat in terms of doing it. So that really got him into the right path. When previously he'd been told, hey, go to counseling, do this, do that, but it never was connected to him personally and what was important to him. So that's where the motivational interviewing and the techniques to help people move into behavioral change come along. And there's a whole science to that. So you just have to learn them. You need to bring them into the practice.
How long did you know this patient before he opened up to you like that?
That's the first time I met him. Okay, the first time I met him. This is the remarkable thing about some of these tools. If you ask a patient what's important to them and you let them write it down, it's not a checklist, okay? It's hard to say, okay, pick out of these 5 things what your life is all about, right? And then you use that to open a dialogue where you listen, okay? And it is remarkable the honor and the privilege that patients give us as physicians in revealing those kind of deeper things if they think you're really sincere and you're hearing them, okay? You're not just the typing on your computer and that kind of thing. So listening is a key component, and developing methods and patience to do that so you don't interrupt the patient in the first 7 seconds.
Give us an example of some of the questions that you asked this patient to get him to open up, because I'm sure a lot of primary care physicians, they listen to this podcast, they want the same thing, but they're just so limited by the time constraint. It's much easier just to send them to a counselor or write CBD oil. What are some examples of questions that you ask in the exam room?
Yeah, over the last few years, we have consolidated a set of tools that make this easier to do. Okay, and also some tools to learn how to do that. We just finished a learning collaborative where we refine these. I give all my patients now something called the Personal Healing Inventory. You can get it off my website. You can get a guide and some of the resources that then it brings up so that you can actually provide these kinds of things. We've just finished a learning collaborative with clinics all over the country doing this and testing this out and redesigning putting it into the electronic medical record. Many of them have done so they can just pop it in and the patient can do it there. It takes the patients generally about 10 minutes to fill this out, and then it becomes the center of the discussion, of the dialogue on that. So it makes it much more rapid, much more easier to do within that process.
I'll ask you later in terms of how listeners can find that program, but without doing the whole CME and giving it all the way, what are some examples of specific questions that you would ask that's from that program?
Yeah. So one of the key things that I have in the questionnaire in the PHI is what gives you joy? What do you live for? Okay. And they handwrite it in. Okay. That's very important. So there's an introduction on the first part of the PHI that says what this visit is about. It's about your whole health. It's about social and emotional, mind, body, your lifestyle, et cetera, et cetera. So they immediately know that that's what we're going to talk about. Then they write in what matters to them. And then at the bottom of the questionnaire, they indicate on a 1 to 5 scale which area they have the greatest need and the greatest desire to work in. And that goes through things like sleep, nutrition, psychosocial support, social determinants of illness, if they have some basic social needs in those areas. It's a list of things that they just do rate 1 to 5. And you look at that, and that often immediately allows you to focus in on what they say their greatest need is. You would be surprised sometimes, but that allows you to actually have that dialogue. And so if they rate, for example, that their sleep is terrible, it's a 1, then I'll say, all right, let's look at the sleep. How can we support that process? And then that becomes the focus of the health promotion integrative health visit. And then the resources are brought to that. And that's an example.
Now, you mentioned the word surprise sometimes when you read the results of these questionnaires that patients filled out. So just from your years of experience doing this, what would you say are some of the more surprising things that you didn't expect patients to write down in answers to this questionnaire?
This one that I showed you the example of that I write in the article was a surprise to me, because in the little box where you write down what's the most thing important to you, he wrote basically 2 phrases. He wrote my cat and my wife. Okay. And this was after the resident had come in and said, oh, I think this we need to do, after he had put down he wanted to know CBD oil. And I went, oh, I was not expecting that. Right? Okay, that's important. The reality is there are basic fundamental things that facilitate healing and wellness that are pretty common to folks. Everybody needs to have something they're doing that's meaningful in their life. Everyone needs social support. They don't have to have a mental health problem to have a social and emotional body in those areas, and that drives them. Lifestyle, very important for the majority of the chronic diseases that we see in primary care. High blood pressure, obesity, diabetes, etc. Diet, sleep, nutrition, stress, all impact those types of things. And so there's a set of things that come up over and over again that you can create support tools for in those areas. And what the surprising thing is that you often can't guess what they are for the person unless you ask them to tell you. And then that's the direction that you go. I think if there's one thing that surprises me after years of doing this, both in standard primary care, which I still do, as well as trying to bring the integrative or whole person care tools in there, that really has come up just in the last several months, actually, for me. The most thing that surprised me is how powerful mindfulness is. And if a few simple techniques, both on the provider side as well as the patient side, for pausing and not simply becoming a reflex reaction to the thoughts that occur in your head and the responses that patient sends to you. If you just learn how to take a pause, this really helps open up this space where what the patient needs and what you can provide to get them onto their healing journey can emerge. And I've always said stress management and all that kind of stuff, but it's more than that. It's not just stress management. It's really opening up a space to make that kind of deep connection where healer and healee can work.
And where can one learn more about doing that? Because I think what you said was very resonant. Just taking a pause, being more mindful, being more in the moment. And that's something very difficult for us to do in the exam room, where we're always so rushed and we have all these check boxes to click off and all that. Where can one go learn to do that better?
There's a number of places to do that, and increasingly you see technology assists in this process through apps, for example, Calm and breathing activities. The one that I've been using in the last almost a year that I really like, that for professionals, okay, to do, is something called Waking Up. It's an app put together by Sam Harris, and it brings together both practices and didactic instruction in these areas. It's not specifically for healthcare, but it's a very powerful thing and very simple kind of techniques that can teach you that. So it's called the Waking Up app. I like that one a lot. Easy to do. You get a 1-minute thing each day. You get a 10-minute thing each day. You can do all of them or none of them in those areas. There is a formal training in mindfulness for clinicians up in New York out of Rockefeller University. That is, you can actually go and do. They have the online components in that. And it's specifically about the developing mindfulness in training.
We're talking to Wayne Jonas. He's a family physician. We're talking about his latest Kevin MD article titled How Whole Person Care Can Make Us Better Healers. Wayne, what are some of your take-home messages for the Kevin MD audience?
I think one of the important take-home messages that especially physicians need to feel, hear over and over again, and not push away or feel guilty about is that to become a healer, you have to heal yourself, right? Okay, heal the healer. And more than self-care, which is important, you need to take care of yourself so you don't burn out. We're having huge problems with that right now, as everybody knows. So you can't care for the whole person in the way I've described it without taking care of yourself as a whole person. So that's really important. And the way you start on that journey is self-awareness. Okay, you have to know yourself first. And practices like being aware, like the journaling that my patient did, I do myself. And we have instructions on how to do that. Helps open up these deeper unconscious aspects of your mind so that you can more fundamentally answer the question of what brings you joy in life. And this, I think, is the remedy really to burnout and the continual onslaught of the incessant cure that buries healing so often in our day-to-day methods. This can be done, but it starts with self-awareness. It then leads to self-care, and that allows you then to care for your patients.
And where can listeners find more about the resources that you talked about?
So we have a huge number of resources on my website at drwaynejonas.com, and it includes the PHI, it includes the Hope Tools, and includes all the support resources. We've collected around the country a number of them that are inexpensive, easy to use, that can be worked with patients, a whole series on pocket guides that give the science and the practice of each of these kind of behavioral components that facilitate health and healing in those areas. And so those are all on the website. They're free, and I encourage everybody to go there, download them, and start using them.
Wayne, thank you so much for sharing your time and insight. Thanks again for coming back on the show.
My pleasure. Thank you, Kevin.